So disabilities are some form of impairments that affects an individual or a person's ability to interact within the society. So it can be within the environment as well as even interact with people within a society. So a disability can be acquired. So, for example, a mental health condition, it can be traumatic brain injury, or it can be one being diagnosed with a chronic illness condition, medical condition that has led to a disability. And then we have those that are biological. So it can be an intellectual disability, sensory impairment. It can be developmental disorders. It can be a physical impairment that has occurred. So the United Nations Convention on Persons on the Rights of Persons with Disability defines disability as impairment in the area of intellectual leading impairments in the area of intellectual, sensory, physical, and mental functioning that causes difficulty for the individual to fully or effectively interact with barriers within, his or her society. So in that regard, you're looking at even the impact it has on the ability of the person to move, the ability of the person to actually think, and then the ability of the person to interact with others. We have majority of the population falling within the structure of what society views as normal functioning, and persons with disability may end up falling outside that category. So, in that regard, it helps. It's helping me to actually explain to you why stigma comes in, because then because of the normal functioning, anything that is outside what is we define as ideal or ordinary is looked down upon or treated negatively or even stigmatized. So you find out that people with some form of disability may be bullied. People may develop some negative um, behaviors around them, and it can also go a long way to also have a negative impact on the individual's functioning. So sometimes persons without disabilities can treat persons with disability poorly. Okay. And even research by the CDC and then the United Nations Convention on Rights of Persons with Disability states that even the way our society has been designed is being designed in such a way that it actually negatively affects persons with disability because they have to maybe a car is not designed to in such a way that it would cater for the needs of somebody with an impairment or a disability, or the classroom structure is designed in such a way that the person who is unable to hear cannot receive the best of um, 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 resources to be able to also learn and then work towards meeting his full potential. Because in the classroom, the teacher expects that everybody should be able to understand what I'm saying or be able to function well. So in that situation, even sometimes how society has designed it also can have a negative impact on a person with disability, because then the person becomes more stressed because they tend to lack certain opportunities or incentives or resources due to how the environment has been designed. So it negatively impacts on them as well. Already they have an impairment that already puts a stress on them, and then also how we behave, persons without disabilities, and even the structures or the built environment is designed also goes also a long way to also affect persons with disability or some form of impairment, be it acquired or biological. The CDC says that research by the CDC have indicated that persons with disability tend to are more likely to report mental health conditions than persons without disability due to the struggles or the challenges that they face within their environment and all that. So these are some of the things that may lead to, besides the fact that besides the person's condition, the person may also have an underlying condition that when he or she is faced with a stressor can also trigger a mental health condition. The expectation is that anytime when an individual is faced with any mental health condition, now the individual has access to a mental health professional in Ghana. So you can visit a hospital or a private facility, both public or private, and then you can have access to a mental health professional to help you with any mental health condition based on the severity. However, you realize that when it comes to persons with disabilities, they might need extra resources than those without disability. And those extra resources are not there. So, for example, if someone comes in to see a psychologist or a psychiatrist and the person cannot hear, you might need, for example, somebody who is an expert in sign language. And sometimes there's that struggle to get such a person in. And if that person is also not available, the specialist cannot see such a person with such a disability. And so you realize that not much has been done when it comes to mental health interventions and disabilities. And there's a lot that we need to strategically put in place to also ensure that there's inclusion. So we include all these vulnerable persons so as to be able to get the best of care when it comes to treating mental health conditions. So in Ghana, when it comes to psychological support interventions for persons with disability, a lot of research has to be done so as to be able to put in place the right resources to help persons with disability, because every person with disability may have a unique resources that they would need to help them access, let's say, mental health support interventions. So research has to be done so as to be able to tailor towards all the various disabilities that we encounter in our environment, so as to be able to help these persons receive the best of care when it comes to mental health support intervention. So I think that a lot of research which has not been done needs to be done in that area so that we can put in place the right resources to help persons with disability to access mental health support services in Ghana. In Ghana, mental health intervention has come a long way. At least now, the stigma around mental health is reducing. There's a lot of mental health education going on. There are both private, public hospitals and facilities have mental health specialists or experts to provide mental health interventions for persons without disabilities. However, you realize that there's a lot of work when it comes to providing mental health support services for persons with disabilities, and that resources are needed to provide the best of care for such people. And they don't exist at the moment. So yes, a lot of research needs to be done. I mean, in Ghana, how many hospitals have employed experts in sign language? We need these things. In Ghana, how many hospitals and facilities that render mental health support services have the Braille, for example? we don't have all those things. And persons with disabilities to experience mental health conditions, whether it is mild, moderate, or severe or extremely severe. And they also deserve and have a right to be treated when they are in need of mental health interventions. And therefore, if they are not treated, then that means we are not, reaching out or providing services to everyone. So we need to also look at inclusion and put in place all the necessary resources to help those with disabilities or impairments also receive the best of care. And I think that with that, we are responding more to humanity than just doing half and leaving the rest, which I think a lot of work has to be done on that, and government have to do better. Both government and international organizations need to do more to support persons with disability when it comes to receiving mental health support services in Ghana. Thank you.